Yeah,
I
hi.
know. I know. We got
But
disconnected.
yeah, but that's how life is. The day
Yeah,
is
that's what is life now. True. Okay, so we were on the causes of infertility in women.
right. So, normally when the couple comes to me, we investigate and find out what is the cause. We take a history. We do is the guy is for investigated first, collect his sample, and we'll come to know whether the sample has a problem or not. So, find male cause of infertility. Just do the semen testing. But the lady is more complex individual.
Yeah,
Like
yeah, yeah, yeah. Ladies,
women,
obviously. Everything I have to do is done by a female only, whatever it is.
but man in this particular thing, man is easy to find out. So we always investigate the husband first. Many times I get couples where the husband is not at all investigated. Someone has taken treatment for 3, 4 years. And when the test of the guy that he,
Yeah,
in the
yeah.
old like 20, 30 years back, get practice. And this guy who came to me, he married second time, and
Okay,
he was a problem. He had no sperm.
okay. So we have seen all this in movies, not reality. Actually, truly.
Right. So the
Okay.
that's the whole issue. So in the women, of course, we do the hormone test nowadays. We do prolactin. There's a very important test nowadays. It is called anti-molecular hormone (MH).
Okay.
Very important because it gives you the current reserve. And so in the normal, the range is 2 to 3.5 nanograms per ml. If it is less than 1.5, per, and if it is in previous, a lot of patients in my north, Delhi and all these people, they have a lot of PCOS, polycystic ovarian
Yeah,
syndrome,
yeah, yeah.
and in them the AMH is quite high, more than 4 AMH. We know pakka that there is a polycystic.
Acha. So now there's a more science has actually come up, so there are a lot of clarity now.
So it's very easy now. You just do a scan, you see a multiple follicles, and
Okay, that way.
PCOS can easily
Okay,
become when
okay,
problem is more the patient who have a low M, less than 1.5, and so this is big. Coming back to investigation, so the hormone test, and
okay.
then we the ultrasound of the nowadays we do a 3D ultrasound.
But this test is only for females. Matlab, is infertility is only in females or male?
No, no,
No.
no, no. For it in male, we do the semen test. The semen is
Okay,
so that it's a male factor, and in 30 to 40%, it's a male who is having a. So if
okay, okay.
bad, we will treat. We'll find what is the cause. Give them medicine. And we have to do surgery, and with that, they
Understood.
counts improve and they become pregnant. But if the semen test come normal, then we look at the woman. So we try to do the
Acha. Okay,
AMH, prolactin, thyroid level. Thyroid also can cause infertility. Hypothyroid. So a T
okay.
more than 2.5, normal 5 is cut off in non-pregnant. But
So these are the factors which are related to this.
so and then we
Okay,
look at the plumbing also. Like the uterus,
okay.
whether they are not. So for that we either
Understood.
a 3D ultrasound nowadays, a three-dimensional
Okay. So,
advanced.
there is a myth, I should say, or I have a question in mind. If I had a baby once, can I be infertile now or no? If I am already, I had a baby once.
You can have a secondary infertility also. So
Acha, okay.
it may be
So this
difficult
case
to have
is possible.
infertility. Primary infertility, you have never conceived and had a baby. And second,
Correct.
when you conceived but didn't have conceived the second time.
Okay.
A lot
So
of
there are rare cases or they are very common cases nowadays.
yeah, yeah, yeah. There's a lot of people who come to me for second. infertility also.
Okay. So this is actually a
Because
strange thing. I wasn't aware about this.
the delivery, the uterus get damaged. After an
Okay.
they have their first kid, then they go for an abortion. The tube may get blocked. Many of
Acha.
them have the first, then they don't have the second kid. Then they come at 39 years of age. The first kid wants the sibling. Then they come. Then it's as the age advances, the
Yeah.
fertility increases.
The chances of getting this
Then
acha, okay, decreases.
easily. Then they say, "Oh, doctor, now I want another kid.
Yeah, yeah.
My child is wants."
Okay.
So
So
so that
now, doctor, is this fertility problem is very common, I think.
it's
You must,
10% men in our country are much. So the
yeah,
population all the time growing, the population. So the infertility incidence is growing. So the absolute
correct.
number is growing. But when I started infertility practice in 1990, I was 7 in India to start IVF center. Now we are 3,000 IVF centers. So as the population has grown, so has the
The
doctors the specialty practice of IVF.
okay. And does there an age effect on fertility? Is there any particular age the
No,
couples come to you?
sometimes I advise my patients and that you should get pregnant before the age of 35. After the age of 30, children go up. The becomes more and more difficult to have children. Even with IVF, the pregnancy rate before 35 is around 40-50%. After the age of 35, pregnancy starts. By 37, the pregnancy
Correct.
30%. By 39, it is 15%. By 41, it is only 10%. By 43, it is 5%. So as the age advances, of eggs go down.
Acha. Okay,
And
okay.
you must have the child parallel with you.
But like I am a mother of two, so I wanted to know one thing. Is it, can I do something which can prevent fertility or something? Infertility, sunke, that word is a negative word, whatever it is. But
Right?
then can we prevent infertility or it's by, it's
No,
an
no.
individual's body?
So when you get married, you must first of all plan a child. Now government of India का वैसे भी slogan है कि पहला बच्चा 2 बरस के पहले नई शादी के बाद 2 बरस के बाद पहला and then second after two spacing
Correct.
करके. But what
Correct.
all married couples should do a simple test. A guy should do a semen test and a woman should do a AMH and a ultrasound. If this,
Okay.
then you can postpone having kids by 2-3 years.
Okay. Okay.
Abnormal. Suppose the count is very low or AMH is very low, go straight for the treatment because then you start treating. If you are okay, then so I feel there should be screening. Everyone should do. Even I.
Okay, so we aren't aware about this basically. People don't go for tests easily because they are not aware about it because there are so many things which have come up.
Right. And the second thing I would like to emphasize here is in prevention is of course prevention is from you must practice safe sex. So, because the society become more open
Correct.
nowadays. After the age of 18, once you are adults, you may have marital sex. A lot of people are single. So you must use a protection barrier like condom because infection can cause
Correct.
blocking. So safe sex is very important, not only from but from HIV point of view also.
Yeah,
So
yeah, yeah, yeah.
very important. You must avoid unwanted pregnancy. If suppose you have sex and you become pregnant, even after marriage, you
And
become
then
pregnant.
people at home start taking that pills also without taking, any advice from the doctor. So that should not be done.
Right. So unwanted
Yeah.
pregnancy, so then abortion can cause a blockage of tubes also. So,
Correct.
so safe sex, unwanted pregnancy, assess your fertility. Suppose your
Correct.
fertility, then you can freeze. Suppose husband's count is 3 million, normal is 10 million, 15 million plus.
Yeah, 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 yeah.
Is your sample for the future. Or if your AMH is low, woman AMH is 1 point. Hello.
These people who are facing the problem, they know about IVF, but I think a lot of people think ki IVF is just a solution. If you're not having a baby, go for IVF. So,
Right.
what is your perspective on it?
For IVF, I would like to complete that if suppose a lot of the girls are now not getting married, so even
Yeah,
they get have kids after the age of 35. But then what happens? The fertility starts falling down, and even the IVF results go down. So you must freeze your eggs before. So I have a lot of patients, lot of professionals. They come to me and freeze their eggs before 35. So suppose you are 30, and before
yeah,
30 you want to freeze your eggs, I'll say, okay, do an AMH. Normal don't no need to freeze. But I've seen that in recent times, a lot of women have started having decrease in their ovarian reserve. The AMH levels are, in normal. Just now, there's a big actress which come to me. She around
okay.
36 and point 0.3. I was shocked. So what I'm trying to say is that she was also shocked. So like I wish. So
So
what
this
I'm trying
is
to tell you is
just
that
tell me one thing. I would ask you one thing. Is it safe? मतलब है तो it is a medical treatment only. Freezing eggs
yeah,
is
yeah, but
also
it's very safe. And so I personally feel, because what has happened nowadays, if you have a child, say at the age of
yeah,
32, and
yeah,
professionally you're in, let's say in a of IT industry, you are now 32, you are very dynamic, and there's another man who is competing with you for the same post. Suddenly you
correct.
become, then you go back by 2 years.
Yeah, yeah,
So
yeah.
they are saying no, I will freeze my ex, I will postpone my
Okay.
achieve my goal, and then I will use my frozen eggs to become pregnant. In fact, a lot of IT industry now, like Facebook and all, they give compensation. They give money for freezing eggs. So they feel
Correct.
they are at a disadvantage. So
Okay.
the men's word. So a woman, because she was pregnant, she will get set back. So you can give her this option of freezing the eggs, so she can have. So I feel that it's not necessary.
So basically now a female have that power to professionally grow as well.
Right.
So that's
So,
not the thing कि अगर मैं pregnant हो जाऊंगी तो मैं ये नहीं कर सकती वो नहीं कर सकती. So there's an option.
right.
So,
So,
okay, I have one personal question. If I have one child and then I take a break for 2, 3 years and then I plan that I should freeze my eggs. So, even after first baby, a female can freeze her eggs.
yeah, anytime you can freeze your eggs. But in fact, a lot of people, they after the first child, I've had a couple. She's also an actress, and she asked me to freeze my. Can I freeze my embryo? She's married.
अच्छा.
You are married, but आजकल के जमाने में तुम लोग का कुछ भरोसा नहीं है, तो better to
हाँ.
freeze rather than embryo. Because you freeze your embryo, you are committed to the man. You know.
Okay. Oh my God. Okay, that way.
So suppose
Okay.
sometimes we have issues where they are married, they freeze their embryos, they are doing IVF.
Okay.
Then after 5 years, when they are divorced now, so they are fighting for the embryo.
Okay. Acha, all these
They
things.
want the with that embryo. He'll say, but I don't want the child. So these are
Correct.
all that can happen in the future. So, but
Correct.
this is the lifestyle. See, our India is very advanced. I always feel that we are more advanced than even America. We are quite
Ach-
attitude. The social thought process of Indians is very.
Correct.
I am of the opinion, and it's a matter of fact also. So they will not get scandalized by all these things. They are doctor. Okay. They are very finicky about religion, this, that, but they are okay with the lifestyle because they are personal
Correct.
issues. So
Yeah,
coming,
yeah.
so this is as far as egg freezing is concerned, preventing fertility is concerned, etc. Now let us come to actual treatment. So
Yeah.
if the patient is there, come to me, I'll investigate the husband and wife. If everything is normal, then I will. What is happening is straight away jump to IVF. That cannot be
Okay.
done. First, there is a simple treatment called ovulation. Create few follicles, few eggs. Then
Okay.
do is we take the husband sample, wash it, and best form we put into the uterine cavity. It is
Okay.
intra, and with
Okay.
that, many people achieve pregnancy in 3 to 6 months time. Only
Okay.
people who fail to achieve pregnancy, then for them we do IVF.
Acha, so there is a middle way in between of not getting pregnant and directly going to IVF.
In fact, before that also there is something called planned relations. So there are people, there's a
Okay.
large amount of let's say providers who are getting pregnant without IVF. So they will do your BMI, they'll do
Acha. Okay.
your they'll reduce your weight, they'll de-stress you, they'll cleanse
Okay.
you, diet and exercise. They will tell you when the ovulation occurs. So with all these nice things,
Okay.
you become pregnant on your own without the doctor.
With other doctor.
So
Okay. So, Acha, I want to also ask you, how is this cause of fertility, infertility is identified? Just if I'm not getting pregnant, so it means I'm infertile,
you
or
should be
there.
pregnant for 2 years after marriage. Once
Okay.
marriage,
Okay.
then we investigate the husband, we do the semen test, to investigate the wife for blood test, value, pH.
Okay. Okay.
We'll do our ultrasound and to see whether the tubes are open or not. First,
Okay.
HG, hysterosalpingography, long but simply
Acha. Okay.
test. And very rarely we also do a laparoscopy. So if we find any
Okay.
fibroids or we find any endometriosis, we put a scope in the tummy. Uh,
Okay.
the operation within 1 day, patient can.
Science has actually come up with many tests which are related to all these things. It's not only one. So ऐसा नहीं है कि अब किसी चीज का solution नहीं है. We have the solution for every problem now. Also tell me, doctor, nowadays you know that the diet of unmarried girls, they are drinking, they're smoking, everything is very common nowadays. Even consuming drugs. So, do all these things also affect the fertility of a female?
Yeah, surely. So the if they smoke or they drink, it reduces their fertility status and all. So, but
Okay.
it's a good time and place for everything. So, if you are wanting to have a child, you have to cleanse yourself. See,
Okay.
can't tell everyone ki don't smoke, don't. That's what to tell them that once you want to focus on trying to get pregnant,
Correct.
then you
Correct.
need the lifestyle change. You need to lose weight. You need to de-stress yourself. You cleanse yourself by by totally the smoking process. Smoking, as I think, between drinking and smoking thing possible. So we should
Okay.
actually smoking should not be done only. And
Oh, correct.
take one classes, okay, but and you are pregnant and all, you should have.
Occasionally. Yeah, yeah.
So I think
Okay. So,
so
I also want to ask you, what about this IVF is very painful or something? Because a lot of females think ki, that is the end thing which she has to go through if she's not having a baby. So, if is it very painful? What are its, the effect on a female's body after IVF?
So no, so basically what I told you that in nearly 80% of people will become pregnant with simple techniques, planned
Yeah.
will and time intercourse, laparoscopic surgery. It's like heart problem. If you have a heart problem, then diet, exercise, medicine, 90% will be okay.
Correct.
Some people may need a angiography and a plasty, and very few people will need to go for a bypass surgery. Similarly, I would say IVF is the last step, that is the bypass. You understand?
Yeah,
So
yeah, yeah, yeah.
so when you're doing that, it's the process is very simple. You take injection for 11 days, but now these new injections have come, which are very painless. They are
Okay.
very thin needle, like the insulin injection, so they don't cause
Okay.
that much of pain. And
Okay.
then once you are take those injections, many eggs are formed. Then you get admitted, and we give a propofol, which is a fantastic anesthesia. The greatness of this anesthesia is that you,
Correct.
as soon as the anesthesia wears out, you can go home in 2 3 hours time. So with
Okay.
the
Okay.
light anesthesia, we take the eggs out by from the inside. It's a small, tiny, thin
Right.
needle.
Okay.
So it's
Okay.
not no cut is there. We quickly take the eggs out, and within 3 4 hours, patients can go home. So that is the
Okay.
when I started IVF in 1990. That time
Yeah.
we had to put a laparoscope and take the eggs out. It was a real and the people and that time the pregnancy rates were 5%, and people used to come again and again and again and do laparoscopy. Imagine. So that
Okay.
then the advancement of this new technique of ultrasound vaginally came in. So it
Okay.
really revolutionized IVF. Today, nearly
But I
90%.
want to ask you one thing over here. What this is all these treatments are available, agreed. But can a middle class person also go through it? I think I don't know. It is very expensive. What is the fee structure for all this
So
process?
yeah, so an IVF cycle in All India Institute is available for 50 60,000 rupees. Of course, there's a long waiting list. So the
Oh, yeah,
on
yeah.
an average between 80,000 to 1,50,000 is a cycle cost, and
Okay.
because this is a World Infertility Week from today only. Today is a
Yes.
very auspicious day. It is a World
Yes.
Infertility Week beginning. So we have in our Mumbai center, we are now giving 50% discount for patients whose annual income is less than 2.5 lakh rupees a year. Because
Okay.
me and my colleagues, my wife, Dr. Ishma, my partner, Dr. Nandita, all of us decided that we will give it to, those, what is that card is there, na? But that
Yeah,
card
yeah.
the card holders are very poor. They are 60,000. I said, what 60,000? Even 2.5 lakh rupees person who earns 2.5 lakh may
Correct.
not afford it. So I made it. I didn't do the cutoff of the card. I did it for the more 3 times higher amount, 2.5 lakhs.
Okay.
Because I
So,
believe
but
in
do you during
service.
this, but do you think during this week people will come to you by looking at the scheme? Do people
No, no,
come
no.
in
It's a
previous week?
permanent thing I am doing for poor. See,
Acha, okay,
our country is made up of two parts. One is the 100 million, 200 million people like you and me who have
correct,
who are fortunate enough to get good things of life,
exactly.
and there are 1.1 billion people who were very poor. So
Yeah,
have to see. There is a guy called Piketty who wrote a book called Capital. He's a
okay,
French guy, and he said that wherever when the people who are well off must stop giving, then the revolutions occur in the world.
correct.
We have to. So
So true.
my premise is that we should give. Of course, many times when we become older, we say, "अच्छा now मैं अभी सब कुछ पा लिया, अभी मैं सोसाइटी के लिए काम
Right.
करूंगा,
Yeah, 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 yeah.
right? But now I feel that that time is gone now. We have to
Correct.
work for society as a commitment, because if we
Correct.
don't do that work, na, society will not allow us to live. So
That's
my
where that come that CSR initiative, which we call nowadays corporate social responsibility.
they are not corporate social, they are self social. We have to work for the poor if we want to survive in the future. See, the
Okay.
world has become so disparate, and that the top 5% of people in the world, they hold the wealth of and the rest of them don't. So
Correct.
obviously, 95% people are going to look at you in a very negative fashion. You
Yeah.
have to demonstrate to them that you care for them,
So
and
that's
nobody
what
was
that's
here
what I
to
said,
do it for
doctor.
them.
You are taking an initiative, but everyone is not taking an initiative. So, it is a very, it's not a very easy job, I would say, because, you're thinking about that sector. And I think that sector is not also much aware about IVF. उनको नाम से ही लगता है महंगा होगा. So,
It's funny thing is that after COVID, all of us are going to be that sector. ऐसा लग रहा है अभी.
oh God,
So,
so
it's
true.
like the definition of poverty is slowly changing. And
Changing now.
मैं आपको बोल रहा हूँ कि 1.3 मिलियन में से 200, अरे उसमें से भी 150 ऑलरेडी पुअर हो गए.
Already for correct, correct. So true.
So,
But during
मेरा
this
एक
COVID
फिलोसॉफी है कि
times,
हेल्थ केयर, pardon?
during this COVID times, do you think there are a difference in the patients which are coming to you for IVF or
No, no, there, no, no. Yes, there is a difference. What is happening now? Now, suddenly I'm getting patients who, there are two types of patients that are coming. See, पहले तो सब लोग आते थे. अभी क्या हो रहा है?
correct?
Patients who are older, who have, they are coming. AMH is very low.
Okay,
Patients who have failed 2-3 times before with IVF, they're all coming to me. Patients who are egg freezing patients have started. In fact, India में इतना नहीं हुआ है, but abroad में it's like a crazy. All the single women abroad are coming for egg freezing. They have become very insecure, because what used to happen that most of the time during the non-COVID time, they
correct.
used to get the guys in the bars and in social gatherings. All that
Yeah,
is
yeah,
totally stopped. So women have become very insecure. They are not meeting, men and women are not meeting each other. So marriages are not happening. So
correct.
this has resulted in such a big insecurity that huge amount of single women are coming for freezing their eggs abroad. I am also getting
Okay.
little bit of higher number of egg freezing patients. But हमारे इधर
But
क्या है,
aren't
ज्यादा
they
करके.
scared to visit the hospital? Aren't they scared, getting out
Yeah,
of their
yeah. So
house?
abhi so, but there na, so we have some units which are private units. Our so
Okay,
there in during COVID time we are doing more work. लीलावती में नहीं करते हैं, पर हम प्राइवेट में ज्यादा करते हैं. मुंबई में दो, in Delhi somehow our Fortis Gurgaon Fortis unit as well as our GK2 Fortis LAFAM unit, both the units we are doing patient. Delhi patients are ज्यादा daring वाले. North Indians are ज्यादा daring.
yeah,
बिंदास
yeah.
होते
That's why
हैं.
you can see in the news what's happening in Delhi. We are
हाँ.
on lockdown again. There is a lockdown and
Yeah.
we are at home now.
Right. But मेरी सोच ये है मैडम, आई कैन स्पीक इन हिंदी ना.
Yeah, yeah, yeah.
या,
Please.
या. मेरी
Hindi,
मेरी सोच
Hindi
क्या
का
है कि हाँ,
मातृभाषा.
नहीं नहीं, मेरी सोच ये है कि ये कोविड में लॉकडाउन नहीं करेंगे तो ये वेव बंद नहीं होगी. तो माय थॉट प्रोसेस इज दैट इन द फर्स्ट वेव क्या हुआ था कि आफ्टर द वेव केम डाउन, देयर वाज अ
Correct,
पीरियड ऑफ 6 months व्हेन देयर वाज वी वर डूइंग वेल, but there was restriction. So we need to all
correct,
sit down together, our experts, and find out ki what were the things we did in those 6 months which had
correct,
resulted in control of the wave.
correct,
So after the second wave goes down, जो हम लोग ने पहले किया था ना, वो ही हमको 3 बरस के लिए करना पड़ेगा.
करेक्ट,
वी
सो
कैन
ट्रू।
नॉट लिव, वी कैन नॉट लिव द रिस्ट्रिक्शन, प्लीज अंडरस्टैंड, क्योंकि हमारा जो पॉपुलेशन है वो 2 बिलियन का, हमको 1 बिलियन
या,
पॉपुलेशन को 2 बिलियन डोजेस लगेंगे, 2 डोज
करेक्ट,
लगते हैं ना हर बरस,
करेक्ट,
2 बिलियन डोजेस कहाँ से आएंगे डोजेस? सो इसके लिए ये जो लॉकडाउन के बाद, अभी ये वेव, अभी लॉकडाउन तो कर ही देंगे सब लोग, उसके
करेक्ट,
बाद जो थर्ड वेव, फोर्थ वेव, फिफ्थ वेव नहीं आने के लिए हमको एक कंट्रोल परमानेंटली रखना पड़ेगा, जैसे कि कोई भी एनक्लोज जगह में नहीं जाने का, कोई भी,
करेक्ट।
मैं आपको सच में बोलता हूँ, रेस्टोरेंट में जाए, अभी मेरे बहुत से रेस्टोरेंट ओनर भी है, बोलेंगे डॉक्टर भाई को मारो, वो बोल रहे कि रेस्टोरेंट नहीं जाने का। मैं बोल रहा हूँ रेस्टोरेंट में नहीं जाना, रेस्टोरेंट में बाहर बैठना।
हाँ,
So we must allow the authorities to say कि भाई आप अभी उनको लाइसेंस दो, जैसे कि फॉरेन में होते थे ना, रास्ते पे टेबल डाल सकते हैं, तो
करेक्ट,
रास्ते पे टेबल सर्व करना, या
या,
मॉल में तो जाना, मॉल में तो यदि जाना है तो मॉल का जो सिस्टम है ना, एयर हैंडलिंग, एसी जो है ना, एसी क्या करते हैं, वही हवा को सर्कुलेट करते हैं, तो
दैट
वो,
इज द प्रॉब्लम। हाँ, वो
हाँ, तो
प्रॉब्लम
वो
तो
चेंज
मुझे।
करना इम्पोर्टेंट है, और वैक्सीनेशन लेना जरूरी है, बहुत ही इजी है वैक्सीन, मैंने लिया है। और वो जो वैक्सीन है ना, जो बोलते हैं कोविशील्ड, वो
हाँ,
अब्रॉड में, यूरोप में 1 लाख पेशेंट में 4 पेशेंट में क्लॉटिंग हुआ, इमेजिन, 1 लाख पेशेंट में
और
4,
उन्होंने इतना शोर मचाया कि
इतना
इसको
शोर,
बंद
मैंने भी
कर दो।
वही वैक्सीन लिया ना, मेरे को
मेरे
कुछ हुआ क्या?
मेरे इन लॉज को लगी हुई है, सेकेंड डोज की वेट हो रही है, मेरे पेरेंट्स को भी कोविशील्ड कर दी है,
सो
एंड विद
तो
गॉड
मेरे को
ग्रेस
एक एडवाइस
एवरीथिंग इज
आपके
फाइन।
व्यूअर्स को देना है, वेयर इज द, तो वैक्सीन के टाइम में जब आप जाते हो ना वैक्सीन लेने को, वो टाइम के उसमें हम मास्क नीचे करते हैं, उधर वो जहां हम इकट्ठा बैठ रहे हैं ना
हाँ,
रूम में, उधर कोविड
करेक्ट,
लग रहा है, तो
करेक्ट, तो
वैक्सीन
वो
से नहीं हो रहा है
प्रिकॉशंस
कोविड।
लेना है,
तो
या,
वो उधर का माहौल है ना, क्योंकि हमारे जो बड़े उम्र के लोग हैं जो 1 बरस
हाँ।
से छुप के बैठे थे घर में, पर वो जो बड़े उम्र के लोग 1 बरस छुप के बैठे थे, अभी वो निकले बाहर वैक्सीन लेने को,
और
वो
उन लोगों
टाइम,
को वो प्रिकॉशंस लेना है, चेयर पे
हाँ,
हाथ नहीं
वो
रखना है, लिफ्ट
प्रिकॉशन,
में ऐसे नहीं जाना
यानी
है।
आई वाज जस्ट थिंकिंग इन माय माइंड कि क्यों, किधर किधर, कहाँ, बिकॉज अभी क्या हो गया ये टाइम,
करेक्ट,
बिल्डिंग में जो रहते हैं ना लोग, उनको ज्यादा हो गए, अभी बिल्डिंग वाले
हाँ,
1 बरस तो छुप के रहे थे, अभी किधर, अरे बाबा कहाँ उनको एक्सपोजर हुआ? हाँ, वैक्सीन जब लेने को गए ना, तब
तो
जो लाइन में खड़े थे, जब
हाँ,
उन्होंने मास्क
करेक्ट,
नीचे किया, अरे आपका नाम क्या, अच्छा, मास्क नीचे किया, बाजू में
हाँ,
जाके बैठे दोनों कुर्सी में, क्लस्टर में, मैंने तो आई माई,
करेक्ट,
मेरे एक दरख्वास्त है अथॉरिटीज को कि आप जब वैक्सीन दे रहे हो, वो माहौल में सेफ्टी करना जरूरी है, मेरे को ये भी एक दरख्वास्त है, आप, आई मे बी फ्रॉम बिग पर्सन इज लिसनिंग टू मी थ्रू योर मीडियम, कि ये जो थिंक टैंक है ना, वो उनको एक्सपांड करना जरूरी है, जो
करेक्ट,
गवर्नमेंट, स्टेट गवर्नमेंट लेवल, या हमारे जैसे जो प्राइवेट में बहुत से एडवांस लोग हैं, बहुत सक्सेसफुल है हम लोग,
करेक्ट,
प्रोफेशन में,
करेक्ट,
बिजनेस में, बड़े बड़े इंडस्ट्रियलिस्ट, उनको इकट्ठा करके एक थिंक टैंक करो,
यस,
1,000 लोगों को लो उसमें,
हाँ,
उनको, उनके से बात करके स्ट्रैटेजी बनाओ 3 बरस के लिए,
करेक्ट,
3 बरस का स्ट्रैटेजी, अच्छा हम कैसा करने वाले हैं, हम रेस्टोरेंट को कैसे करने वाले हैं, हम मॉल का क्या करेंगे, हम एयर हैंडलिंग सिस्टम चेंज करेंगे क्या मॉल में, हम
करेक्ट,
मूवी थिएटर्स में क्या करेंगे, हमारा बिजनेस कैसा चलेगा, ये सब एक थिंक टैंक होना
प्लानिंग के
पड़ता है,
साथ, करेक्ट,
जो जो हमारे देश का फ्यूचर को प्लान करे, ये जो
करेक्ट,
है वो काम थोड़े लोग ही कर रहे हैं, मेरी दरख्वास्त है गवर्नमेंट, स्टेट गवर्नमेंट और सेंट्रल से कि बाबा हमारे जैसे लोगों को लो ना बाबा, हम भी
हाँ,
आपका
करेक्ट,
थोड़ा आपको दे
बट
सकते हो।
सर, आप लोगों की वजह से ही आई थिंक अभी तक हम लोग बचे हुए हैं बहुत कुछ, फिर भी हम तो अंदर बैठ गए हैं, आप तो नहीं बैठ सकते, हम लोग आपके सहारे हैं। आई हैव ऑल्सो सफर्ड कोविड ऑनेस्टली। आई ऑलरेडी गॉट ड्यूरिंग दिवाली एंड वन
So
ऑफ
no, my
वेरी
one more
डिजाइन
thing for your
डॉक्टर।
listeners is that don't now. This is a very big wave. I know it's an economic मैंने disaster for all of us, but we have to stay inside. ऐसा सोच के
यस,
चलो कि
यस,
बड़ा न्यूक्लियर धमाका हुआ है और हमको घर में छुप के बैठना है।
चुप के बैठना है।
और वो 1-1.5 महीना आप बाहर नहीं निकलना वेव कम होने के बाद। और बाद में भी अगले 3 बरस के लिए कोविड अप्रोप्रिएट बिहेवियर करना, डबल मास्क डालो, हाथ धो, और मास्क उतारो नहीं। मैं मेरे स्टाफ को भी बोलता हूँ, आप
मास्क नहीं
मास्क
करना।
को उतारो नहीं। चाय पीने के टाइम में, अरे हाँ चलो 3 घंटा हो गया, अभी काम बैठे, अभी हम चलो चाय
वो
पीते, अरे
भी
चलो तूने
प्रॉब्लम
डब्बे में,
करेगा, वो कुछ
हाँ
मिनट्स में कोविड हो सकता है।
हाँ तूने डब्बे में क्या लाया आज खाने को, अच्छा चलो हम बैठ के मास्क उतारा है, उधर भी
करेक्ट।
लग गया वहां।
हाँ,
अरे हम ना सोशल गैदरिंग में गए, अरे चलो एक फोटो लेते हैं ना साथ में,
तो
मास्क
मास्क
उतारा,
उतारा।
उधर ही
सो
लग गया।
ट्रू।
यू हैव टू, मैं जब घर के बाहर निकलता हूँ ना, मैं ना 1 सेकंड के लिए डबल मास्क कभी नहीं उतारता हूँ। इसलिए मैंने वाइफ को बोला, मेरी वाइफ भी डॉक्टर है बड़ी, बोली सर ऋषि तू 60 है, तू पागल है क्या, क्या जा रहा है। मैं बोला देख, मैं ज्यादा नहीं जा रहा हूँ, पर जा रहा हूँ ना, मैं ना मास्क को,
मास्क नहीं
जान
उतारते।
भी गया तो भी चलेगा, मास्क को नहीं उतारूंगा।
Everybody, I hope you guys are listening. It is very important. Mask is really very important and
मास्क
it
को
will
अब नहीं
save
उतारेंगे ना
you.
तो नहीं हो सकता है कोविड।
करेक्ट। एंड उसके बाद जो हमारे हाथ है, बार बार हम उसको हाथ और
हाँ
माउथ और
वो
नोज
नहीं
में
टच,
टच नहीं
इसलिए क्या
करना।
करने का, डबल मास्क लेने का, एक नॉर्मल मास्क उसके ऊपर और एक 10 रुपए का मास्क आता है, डबल मास्क लिया। और कभी भी ये लगाने का नहीं, हाथ को क्लीन करके फिर आपको कभी कभी खुजन हो जाती है, अरे ऐसा ऐसा करते,
करेक्ट।
ये है ना, बाहर कोविड बैठा हुआ है सब, इमेजिन
हाँ,
वो
तो
मास्क
वो
के
ध्यान
ऊपर कोविड
रखना है।
का जर्म बैठा हुआ है, आप ऐसा ऐसा करेंगे ना तो वो टच हो जाएगा।
करेक्ट। सो अच्छा, मेरे को अब ये भी पूछना था आपसे, अब जैसे प्रेग्नेंट फीमेल्स के लिए ये कोविड सिचुएशन, यू नो इतनी इतनी सारी न्यूज आपने सेलिब्रिटीज में भी सुनी होंगी, सब प्रेग्नेंट हो गए बिकॉज लॉकडाउन है। एंड आई वाज वंडरिंग, इज इट सेफ, मतलब उनका बाहर निकलना, हाउ हाउ इट इज, यू ऑल गाइस आर मैनेजिंग उनकी
सुनो तो मैं
प्रेगनेंसी की
प्रेग्नेंट वीमेन
डिलीवरी।
के लिए, हमारे पास तो देयर आर 3 ग्रुप्स ऑफ वीमेन। एक जो है वो नॉन प्रेग्नेंट वीमेन है, उसका उनको मेरा एडवाइस है कि सोशल डिस्टेंसिंग, मास्क, डबल मास्क डालना, हाथ धोना,
करेक्ट।
और क्लोज स्पेस में ना प्लीज मत जाना। मॉल में मेरे को मार डालेंगे मॉल वाले, पर प्लीज अभी तो
बट
मॉल में
नहीं,
मत जाना।
करेक्ट, जितना
मूवी
मर्जी
नहीं देखना,
क्लीनलीनेस
मूवी
हो,
नहीं देखना।
बट वो
और
हवा जो सराउंड कर रही है।
हाँ रेस्टोरेंट में नहीं जाना, क्योंकि वो ना जर्म है ना, वो हवा में रहता है, वो
हाँ,
हवा में। तो आप रेस्टोरेंट में जाएंगे और ड्रिंक लेंगे, जाएंगे, मास्क उतारा, गया अंदर,
करेक्ट। सो
अंडरस्टैंड। तो प्लीज ये बाहर बैठो रेस्टोरेंट में, बोलो ड्रिंक लेके बाहर जाओ, हाथ को सैनिटाइज करो, मास्क उतार के लगाओ, कुछ प्रॉब्लम नहीं।
हाँ,
तो ये
करेक्ट।
पहला एडवाइस है। सेकेंड एडवाइस है वैक्सीनेशन करना। तो 45 के ऊपर अभी शायद बड़े साहब, हमारे मोदी साहब शायद
कर दे।
18 बरस के बाद के लोगों को भी अलाउ करेंगे। तो पहले वैक्सीनेशन करना।
यस।
वैक्सीन पहला शॉट लेने के बाद प्रोटेक्शन नहीं आता है, सेकंड शॉट के बाद 15 दिन के बाद प्रोटेक्शन आता है। वो भी क्या है प्रोटेक्शन, आप यदि आपको लग गया तो आपको इतना सीवियर नहीं होएगा कि एडमिशन होना पड़े, क्योंकि मेरे बहुत से फ्रेंड जो डॉक्टर लोग हैं उनको वैक्सीन
ओके,
के बाद जब लगा हुआ है कोई भी एडमिट नहीं हुआ है।
वेरी गुड, वेरी
तो
गुड।
जो
So
वैक्सीन
guys, have listened to this point, get vaccinated, and after second vaccine, at least after 15 days, you will not get an admission into a hospital. What जो भी अगर by chance हो भी गया, It can be
Right.
resolved at home.
It's a mild disease because I know मेरे 5-6 दोस्त एकदम नजदीक के उनको हो गया है, तो वी आर हैप्पी इंफॉर्मेशन कि हाँ माइल्ड हो रहा है, वो यानी
Correct.
इंटेंस, बट प्रिवेंट नहीं करता है, होता है। इसलिए मास्क,
Okay.
3 चीज डालने का, डबल मास्क, हाथ धोना, और
Correct.
अंदर मत जाना, किसके घर में नहीं जाना।
Correct.
कोई तेरा आपका भाई होए बहन होए, किसको भी मास्क नहीं उतारना, फोटो नहीं निकालना, सेल्फी मत लेना। ओके, तो दिस इज द फर्स्ट थिंग फॉर नॉन प्रेग्नेंट वीमेन। फॉर प्रेग्नेंट वीमेन हु
Yes.
हैव हाई रिस्क, जैसे कि हेल्थ केयर वर्कर है या प्रेग्नेंट डॉक्टर है, अभी यूएसए से 90,000 प्रेग्नेंट वीमेन को जिन्होंने वैक्सीन लिया उनको कुछ भी प्रॉब्लम नहीं है, बट जो उनतर का वैक्सीन है फाइजर, वो अलग अलग तरीके से बना है। हमारा जो
Correct.
वैक्सीन है कोविशील्ड, वो अलग तरीके से, बट कोविशील्ड में भी ऐसा कुछ नहीं है। तो आप प्रेग्नेंट होगी और आपको रिस्क ज्यादा लगता है तो आप ले सकते हैं
Okay.
वैक्सीन।
Okay.
ओके, और थर्ड एक जो ग्रुप है जो प्रेग्नेंट होना चाहता है, वो
Correct.
ग्रुप भी वैक्सीन ले सकता है, पर
Okay.
सेकेंड डोज के बाद यदि हो सके तो 2 महीना रुक के ट्रीटमेंट करेगा तो बेहतर।
Better. Okay.
इमिडिएटली भी कर सकते हैं, बट हमको क्योंकि 2 महीना प्रेग्नेंट होगी तो वो बच्चे का जो ड्यूरेशन है, बच्चे का वो
Boy,
पहले
that
दो
is the
महीना हमको मालूम
main
नहीं है
time.
एग्जैक्टली
Yeah.
क्या इफेक्ट हो सकता है क्या लॉन्ग टर्म में। इसलिए टू बी ऑन सेफ साइड, सेकंड डोज के बाद 2 महीना रुक के फिर डॉक्टर भाई के पास आना या कोई भी दूसरे डॉक्टर के पास
Correct.
जाके ट्रीटमेंट करना। सो दिस इज एज फार एज द advice to 3 groups
Correct.
of women: the one who are not pregnant, the one who are pregnant, and the one who
Correct.
want to become pregnant. 3 people.
Pregnant.
This is
Yes, sir.
डॉक्टर पाइस एडवाइस। मेरे को
Very
डॉक्टर
good
पाई को
advice,
टेलीविजन पे
doctor.
लाएंगे
Very
तो
good. I
सबको मैं
think
बता
I
दूंगा।
am really enjoying this session. आपने इतनी important information दी है. It's not only about fertility or infertility, but COVID के साथ आपने relate
अरे
किया
बाबा,
है also.
फर्टिलिटी, अरे फर्टिलिटी इनफर्टिलिटी बाद में आता है, पहली जान बचाना।
Actually में
सो
अच्छा,
इवन,
तो मुझे एक और बात बताओ, ये हाउ ऑफन दीज आर सक्सेसफुल, मतलब है तो साइंस ही एट द एंड। तो अगर ऐसा भी है कि कोई कपल कभी अनहैप्पी रहता है, उनका
नहीं तो आईवीएफ में क्या करते हैं हम लोग, अंडा निकालते, स्पर्म लेके बच्चा बना के अंदर डालते, सिंपल है। तो पहले
करेक्ट
आईवीएफ करके फेल हो गया तो मैंने बोला 10-20% को आईवीएफ कर सकते। आईवीएफ
करेक्ट
टेक्निक बहुत इजी है, और 3 अटेम्प्ट में आजकल 90% लोग आईवीएफ में प्रेग्नेंट होते हैं। समझो 10 लोगों को मैंने आईवीएफ किया,
करेक्ट
3 अटेम्प्ट में 90% है, 10 में से 9 लोगों को बच्चा रह जाता है। एक आध पेशेंट में 3 साइकिल के बाद भी बच्चा नहीं रहता है। तो
ओके
उसके लिए ज्यादा एडवांस टेक्नोलॉजी अभी हमारे पास है, जैसे लेजर्स है, तो
अच्छा
जेनेटिक एम्ब्रियो का जेनेटिक टेस्टिंग, बहुत से एम्ब्रियो जेनेटिकली एबनॉर्मल होते हैं, तो आईवीएफ करके भी उनको अंदर डालेंगे तो बच्चा नहीं रहता है, तो हम एम्ब्रियो का
ओके
जेनेटिक टेस्टिंग कर सकते हैं। ऐसे अलग
ओके
अलग टेक्नोलॉजीज है, बट वो ओनली फॉर 10% of
वेरी वेरी
people
वेरी
who don't become pregnant. But the most important thing is, my advice to all of the women is that you must become pregnant before the age of 35. And if you want to, for whatever reason, you may have not got the right person, you may have not, you don't want to have a
करेक्ट
child because you are busy in your career, and you don't want to become pregnant before the age of 35, or whatever reason, please freeze your fertility.
एग, so that
Egg.
is also very very
And
important, but
suppose you're married also, you can freeze your embryo also, but embryo freeze karega so you are committed to the man.
that is that is something else then. But I think a lot of girls should understand that it's not a very sensitive topic now to freeze eggs. It should be done if you're not getting married. At least you're safer. आगे जाके you
But
can
the
have a
problem
child.
is what happens na, Jazz, that a lot of people come at 40 to me for freezing egg. That is the tragedy, na.
That
So
is
that should not
when
happen. You
it
are
becomes
clear
very
in your
late.
mind. You 40 में क्या है, अरे एक अंडा मिलेगा हमको, कम से कम to get a good chance in the future we need to freeze
Correct.
15 eggs, 12 to
अच्छा
15 eggs.
okay
तो
okay
समटाइम तो अभी 40 में एएमएच का लेवल होएगा 0.5, उसमें मैं कहाँ से एग निकालू,
प्यार से होगा
आप समझ गए तो
Guys,
ये
so you guys are, Bhagavan, giving so many lives to so many bachas over here in the world. We have a question from one of the followers.
yeah, yeah.
She's asking, Miss Pooja Mihani, she's asking, would it be advisable to a woman to remove uterus in case of fibroids? Then what about even if not the how painful it is for the women? So she's
Well,
asking basically if a woman is it advisable for a woman to remove uterus in case of fibroids?
oh, acha, no, no. So listen, it depends on whether you are already, if you have already kids, one, two kids and all, and you're
Correct,
40, 42, and there's a large fibroid, you are suffering from pain or heavy bleeding, then you can remove the uterus. But if you are a younger patient, then we only remove the fibroid. Why should you remove the uterus?
correct, correct.
so, so we have now laparoscopic surgery, so you can easily go in and remove the fibroid, and you can go home in 2 days time with small
Correct,
cuts. After some time, you cannot see also from where the laparoscopic instruments were put inside. So
correct.
fibroid, endometriosis, or
Okay.
now even if you want to remove the uterus, that also, but after the age of 40, 45, you would
It
remove a
becomes
uterus.
very difficult.
Ha.
Correct,
So,
correct,
so before that we don't remove, because sometimes for whatever reason, if you lose a child or something, you want to become pregnant
correct.
again, you can't just knock out your uterus.
Okay. So I want to ask personal question. Last question from my side. I want to know one thing. Since I am a mother of two girls now, I am also just concerned about infertility. What should be advisable कि ये problems हो ना? ऐसा क्या कर सकते हैं हम as a parent? What can I do कि in future something like this problem? It is related to diet. I know that, but what
Yeah,
else
yeah. So
can
if you want to,
I can't hear your voice. Your voice has gone. We can't hear you, doctor. Can't hear you. I think you're not audible. I think I have to take you back again. Hello. Can you hear me? Acha, I'll add you back. So, guys.
yeah,
Yeah,
can you?
fine.
Yeah, hello. So you need to lifestyle. Hello.
Yeah.
So lifestyle, weight loss. There's something called BMI, weight in kilogram divided by height in BMI should be 18 and 24. Ideal
Can can you repeat? Can you repeat?
weight in kilograms
Correct.
divided by in meter square. So there
Okay.
are apps that are available. You can go on the net and you can just put your weight and height and you will get the BMI. So your BMI
Okay.
18 and 24 or 25, maximum 27. If you
Okay.
if you lose a weight, even if you lose 5% of the weight, your pregnancy chance will go up by 10-15%. So,
Okay.
but
Okay.
in our in our group minutes of exercise, gymming, then lose your weight, then timed intercourse. With all that, you will become pregnant. You don't need doctor fight.
Correct. So there's one question by the follower, and I am wrapping up soon, guys. So you can come up with the questions. One of them have asked me, what option do women above 40 have then?
Yeah, so many 40-year-olds, I in Japan in 2006. So most of the Japanese women, they get married at the age of 45.
Okay,
So most of them go for IVF after the age of 45. So a
correct.
40-year-old can become pregnant with, first of course, we'll do IVF. And if you don't still become pregnant in 1-2 months, then we do IVF. Very
Okay,
rare. very rarely, if the ovarian reserve is very low, we can borrow an egg from a donor, take the husband's sperm, make the baby, and put into your womb. That is called egg donation. But many people don't like it, borrowing an
Okay.
egg and all that. But many people do it. So these
But
are the
then
various.
doctor, the thing is you have a solution for every problem. I am saying कि किसी सारे तरीके के टेस्ट है, हर एज के लिए टेस्ट है, and I think there will be no couple who can't have a baby now because there's so many things which are
Uh,
available. And
interesting thing before I leave, and that is that
you're
nowadays
not audible again. You're not audible
Japan,
again.
there's some problem. Okay, let it be.
Yeah, you're not audible again. I'm inviting you again.
Hello.
I can't hear you. I'm inviting you
Yeah,
again.
yeah, yeah, yeah. I think
Just
the
disconnect once, doctor. I'll invite you again.
okay, okay. I'll just disconnect. I'll just
Yeah.
disconnect.
Yeah. Now it's fine.
Last thing I wanted to tell you that now with the skin cells, you can create eggs and sperm. So within 5 to 7 years time, you will be sperm from skin cells. So that then everything will become very easy.
Correct. Exactly. You're so true. So true. So it was, thank you so much for such a nice, informative session. And you have also, related it with COVID, with the vaccine. So guys, I think everybody now know that vaccine is must for everyone. So भागने की जरूरत नहीं है. It will gonna save you only. And thank you so very much, Dr. Rishikesh Pai. I am honored to host you today. I wish I get a chance again to talk to you, but we are running out of time. Thank you so very much for giving us so much of precious time. I know आपका टाइम बहुत इस टाइम पे you're running short of time because of you have so many patients, lot of work, and I know you guys are only the front warriors who are coming in front and saving our lives. हम तो अंदर बैठे हैं, but doctors ही हमारा सहारा है. All the doctors, health workers, nurses, everybody out there, thank you so very much. And it's my pleasure to host you. Wish I will do it again. And thanks a lot.
Thank you. I just want to
And
say really
this video I'll be sharing on my channel so that those who missed it, they can see, go through it, and they'll get a lot of information about everything, so that I think we will reach out to many people and spreading such positive vibes and messages to everyone during this tough time. So guys, do watch this video and share it as much as you can, and I'll be sharing this video with you, doctor, too, so that you can share it with your friends and relatives. And over to you, sir.
thank you. I would like to thank you, Jazz. It was great talking to you. Pleasure. And just one request to all your viewers is that for if you want to really be thankful to the doctor community and the healthcare worker community, please take precaution, no? Because more
Yeah,
of it becomes very difficult. And I would
exactly.
like you all to stay home for next 1 month at least,
At
and
least.
venture out and all the time. Remember what I've told you. So when anything comes to your house, the packet, you have to
Yeah,
look at it very as a potential. Even the person who delivers it, you have to see that he has double mask. Suppose he doesn't have,
wearing a double mask.
go
Yeah,
by
yeah,
double, Papa mask pen le. Always go with a double mask. Take the packet, keep it aside. There's nowadays you get ultraviolet containers. So
yeah.
big, you can put the packet for 5 minutes. You just put it in the UV light.
Correct.
You take it out. You leave the packet and never ever eat any food from outside which is cold.
Cold. Okay.
Wife even microwave the cake also.
Okay.
Not
Okay.
melts, but doesn't matter. We mentally we know we are
But
eating a
that's
cake.
fine. At least हमें वो होगा virus
And
नहीं है, germs नहीं है.
the heat kills the virus. Remember that. The
Yeah,
heat
heat
kills the
kills the virus.
okay, and so that's very important. This
Even as
let
an influencer, I get so many couriers. I'm not touching them directly. I wear a gloves. I sanitize with the spray and keep it in my balcony,
don't
bahar dhoop mein, so that
last
then after 24 hours I open it.
last parting request to all you women there that don't have a maid who is going in and out. If you are maid in house, no problem. If you don't have
Major point. Major point.
a maid who will give you the infection, so you have to work on your own. Let the husband and wife
Yeah,
work.
yeah, yeah, yeah.
So this is
सर
very
हम वर्कआउट भी तो करते ही हैं घर के काम करके वर्कआउट कर लो इट्स लाइक दैट so
right.
but to
Take
everyone out
the
there me as a jazz also I am also doing I am cleaning dishes I am doing everything हमारे घर भी maid नहीं आ रही है that is can be the main source so everyone out there अपने maid servants को in and out नहीं करो जिनके घर में रह रहे हैं good enough but don't call maids for some time because you become in that danger zone then so it's for our safety if we do our work ourselves वर्कआउट
right.
करो घर के काम करके करो so thank you doctor it was a very nice session thank you so very much
All the best. All the best to all
thank you
of you.
same to you
Thanks.
okay
Bye.
bye